morning. Today I'm going to be talking to you all about the urinary system. Today we'll be discussing the organs of the urinary system and their function, the diseases associated with the urinary system, and common procedures associated with the urinary system. But first, what is the urinary system and what is its purpose? The urinary system is defined as being a body system that begins with the kidneys as well as other structures. The urinary system's purpose is to regulate and maintain the composition of the blood as well as to remove the waste products by producing and transporting and excreting urine. We're going to start with the kidneys. What are the kidneys? They are reddish brown in color. They are shaped like a kidney bean, hence the name. They each measure 4 inches long and 2 inches wide. They weigh less than half a pound, and your kidneys are located in the lower edge of your ribs, like right around through here in your back. The kidneys also have 1 million filtering units called nephrons. Each kidney is sitting on a cushion of fat. On the surface of the kidney, there's an indentation called a hilum. That is where the renal artery enters, and it's also where the renal vein and ureter exit. Even though the adrenal glands are sitting on top of the kidneys, they are not part of the urinary system. Next is the medulla, which is the inner layer that contains the renal pyramids. The minor calyx connects to the tip of each pyramid, which is an area that collects urine. The minor calyces drain into the major calyx, which later drains into the renal pelvis, which is a large funnel-shaped area. It is also narrowed to become the ureter. Urine will flow continuously through these three. The functions. Your kidneys help to maintain homeostasis in your body by removing waste and extra fluids such as acids. They also balance out the minerals and nutrients in your body. They help to control a person's blood pressure. They also make red blood cells, and they keep your bones strong and in good health. If the blood pressure decreases, the kidneys will secrete an enzyme called renin into the blood. This enzyme stimulates the production of angiostensin, which is a very strong substance that causes blood vessels to constrict, which will increase the blood pressure. We're going to talk about the ureters next. The description of them: they are two 12-inch long tubes that connect the renal pelvis to the bladder. Their opening to the bladder is called the ureteral orifice. The inside of the ureters is made up of smooth muscle that is used to contract urine into the bladder. This process is called peristalsis. These are some of the diseases of the kidneys and the ureters. First, we have nephropathy, which is a general word for any disease of the kidney. Glomerulonephritis. This disease occurs after a strep throat infection. The immune system will produce antibodies, and those antibodies will combine with bacteria that form antigen-antibody complexes. These then will clog the glomerulus pores, and the kidney then becomes inflamed, and the production of urine decreases. Treatment for these are antibiotic drugs, corticosteroid drugs that are used to decrease inflammation, and renal dialysis if necessary. Hydronephrosis is an enlargement of the kidney due to pressure from backed up urine. Treatment is removal of the stone or obstruction. Nephrolithiasis is a kidney stone or callus formation in the urinary system. The treatment for this is an anabolic drug, lithotripsy, or remove surgery depending on the size of the stone. We also have renal colic, which is smooth muscle spasm of the ureter as the kidney stone's jagged edges scrape across the mucosa. Nephrotosis is a kidney that are in an abnormally low position. This treatment may require surgery, such as a nephroplasty. Nephrotic syndrome, this can also happen when there's damage to the glomerulus pores. This allows large amounts of protein to go into the urine, meaning there's less in the blood. Treatment for this is diuretic drugs to decrease the edema and correct the underlying cause. Polycystic kidney disease is cysts that destroy the kidney and leads to kidney failure. This disease, the whole kidney becomes a giant cyst, and the treatment is dialysis or kidney transplant. Pyelonephritis, this disease is characterized by inflammation of the renal pelvis and the kidney. You have to treat this with an antibiotic drug. Renal cell cancer, these are cancerous tumors that appear from tubules in the nephrons. A Wilms tumor is a cancer in children. It's caused by residual fetal tissue. It's also known as a nephroblastoma. The treatment is surgery to remove the kidney, which is a nephrectomy, or radiation therapy and chemotherapy drugs. We also have renal failure. This is when the kidneys stop producing urine. Acute renal failure happens suddenly, usually caused by trauma, severe blood loss, severe infection, and which is caused by acute tubular necrosis, which is when a large amount of nephrons are destroyed at one time. Chronic renal failure begins with renal insufficiency, then turns into gradual worsening damage to the kidneys. This comes from uncontrolled diabetes, hypertension, or glomerulonephritis. This is end-of-stage renal disease. This is the final and irreversible stage of chronic renal failure. The treatment for this is to treat the underlying cause and to treat end-of-stage renal failure with dialysis or kidney transplant. Uremia is the great amounts of waste product in the urea in the blood. This is due to kidney failure. The treatment for that is dialysis. Next, we're going to talk about the bladder. So the function of the bladder and description. The bladder is a balloon-like organ for holding urine. It is located in the pelvic cavity. It is lined inside with a mucosa, which is described as a mucous membrane. The top of the bladder is rounded, and its portion is called the fundus. When the bladder is empty, the mucosa collapses into folds called the rugae. The bladder also has smooth muscle within it. When the bladder is full, those muscles will contract to help release the urine. The neck of the bladder is called the internal urethral sphincter. This is a muscular ring that relaxes when the bladder is full, so the urine inside can come out. This happens without our conscious control. These are some of the diseases of the bladder. First, we have bladder cancer. This is a cancerous tumor that forms inside the lining of the bladder. This is most commonly seen in men aged over 60. Treatment, you can have transurethral resection of the bladder tumor, cystectomy, radiation therapy, or intravesical insertion of a chemotherapy drug from a catheter. You can have cystitis, which is the inflammation or infection of the bladder. The treatment for this is to correct the underlying disease or analgesic drug and antispasmodic drugs. Cystocele, this is a hernia of the bladder. It's also known as a vesicular seal. The treatment is a surgical repair of the vagina or the rectum if severe enough. Neurogenic bladder, this is the urinary retention caused by problems with nerves in the bladder. The treatment for this is catheterization. We also have overactive bladder, which is involuntary contractions that cause frequent urge to use the bathroom. The treatment is medication to control the urges. Urinary retention, this is when someone's unable to empty their bladder. It may be caused by an obstruction or nerve damage. The treatment for this is to find the underlying cause and correct it. Vesicovaginal fistula, this happens when an abnormal passageway forms that connects the bladder to the vagina. When this happens, urine will flow out of the vagina and cause leakage. Treatment for this, you have to have surgery. Next, we're going to talk about the urethra. Those are the female and the male. So the urethra is a tube that carries the urine from the bladder to the outside of the body. The release and hold of the urine is controlled by the external urethral sphincter. The part where the urethra opens outside of the body is called the urethra meatus. In men, the urethra is 7 to 8 inches long and leads through the prostate gland. These are some of the diseases of the urethra. We have epicytitis. The female urethra meatus is in a strange position near the clitoris, and in males, it is a strange location near the surface of the penis shaft. For this, you have to have surgery to treat that. Urethritis is inflammation of the urethra. Treatment, you have to take antibiotics. Albuminuria is protein in the urine. Treatment, correct the underlying issue. Anuria is scanty or no urine production. You have to take a diuretic drug or dialysis. Bacteriuria is bacteria in the urine, of course, antibiotics for that as well. Dysuria is difficulty or painful urination. You have to treat what's going on to cause that pain. Frequency is urinating in small bits but often. So you have to correct what's causing you to have to go to the bathroom so much. Next is glycosuria. This is when there's glucose in your urine, so you have to correct the underlying cause that's causing the glucose to be there. Hematuria is blood in the urine, also correcting, what's causing the bleeding. Hesitancy is when someone is unable to create or start a normal urine stream, and with this as well, you have to correct what's causing, someone not to be able to start a stream. Hypoplakia is when there's a decreased amount of potassium in the blood, usually caused by diuretic medication. So at this point, you have to adjust your medication dosage. Incontinence is when a person is no longer able to hold their urine voluntarily. You have to treat the underlying cause, maybe with bladder training. Ketonuria, ketones found in the urine. You have to treat the underlying cause with why there's ketones in the urine. And nocturious frequency, urinating in the night, and treat the underlying cause for that as well. Oliguria is decreased production of urine because of kidney failure. Again, you have to treat the underlying cause of this disease. Polyuria is excess urine produced, and correct the underlying issue. Pyuria is white blood cells in the urine, and this indicates an infection. So you have to use antibiotics to treat this. Urgency is strong pressure and urge to urinate because the bladder contracts repeatedly. So in order to fix that, you correct what's causing the strong pressure or the urge. A urinary tract infection is a bacterial infection anywhere in the urinary tract. And to treat that, you have to do antibiotics. Enuresis is bedwetting. Treatment is an antidiuretic hormone, ADH, pituitary gland hormone, or psychological therapy to stop that. This is a chart I've created with the formation of urine. So for the first step, you drink, and it goes through your GI tract. Then it starts circulating through your blood, and next it goes to your renal artery, which then goes through your nephrons. After that, you'll see it in your calyces, and then it goes to your renal pelvis, to your urethras, to your bladder, through your urethra, and then finally urination. These are some of the common lab diagnostics that are associated with the urinary system. So some of the common procedures are such things as blood urea nitrogen, which is BUN. This is a test that measures the amount of urea in the blood. Creatine is a blood test that measures the amount of creatine in the blood, and a 24-hour creatine test collects urine over a 24-hour period. You get a total amount of creatine excreted by the kidneys. A culture sensitivity test is a test where cultures are put into a dish and given a substance, and the reaction is monitored. This helps physicians to find a way to treat certain illnesses. Drug screenings are tests for people who, for maybe jobs or something, to see if they have illegal drugs in their systems. Leukocyte esterase, this test is for white blood cells, which may indicate a urinary tract infection, also known as UTI. Urine analysis, UA, is a test that quickly detects substances in the urine. Specific gravity is a test that measures the concentration of urine compared to that of water. Urine-specific gravity is 1.00 and dilute is 1.030, and above 1.030 means that the patient is dehydrated. Intravenous polyraphy, IVP, uses an X-ray and contrast dyes to outline the urinary system and organs. Kidney, ureters, bladder, which is also known as KUB X-ray, is an X-ray of the listed. Nephrotomography, a CT scan combined with contrast dyes, shows an X-ray image of multiple slices through the kidney. A renal angiography X-ray plus contrast dye are used to outline the renal artery, which will highlight if there's a blockage. A renal scan. The kidneys absorb a radioactive isotope, which displays particles that are captured by a scanner and translated into an image. This is done after a transplant. Ultrasonography is a high-frequency sound waves are used to produce an image. This is also known as a sonogram. Cystometry evaluates the nerve function of the bladder. Avoiding cystoscopy, VCUG, X-ray, and contrast dyes are inserted into the bladder through a catheter which outlines the bladder and the urethra. These are next medical and surgical procedures associated with the urinary system. So first we have catheterization, which is a flexible tube that is inserted into a person's urethra so that it goes into their bladder and drains out urine produced. Dialysis, this removes waste products from a person's blood. People who are on dialysis are in renal failure, meaning their kidneys do not produce urine anymore. Intake and output. This procedure keeps track of the amounts of fluid a person takes intake and the amounts they put out in urine output. This is very important. Urine specimen. This procedure captures urine for sample testing. A bladder neck suspension helps to correct stress-related incontinence. A sling is inserted into the bottom of the bladder and the urethra to lift them into a normal position. A cystectomy, this is surgery to remove the bladder because of bladder cancer. A cystoscopy uses a cystoscope to examine the inside of the bladder. A kidney transplant, the kidneys that are no longer healthy are removed and are replaced with new kidneys from a donor. A lithotripsy, this is a type of procedure to remove kidney stones. It is done by using sound waves to break them up. A nephrolithotomy is another procedure to remove a kidney stone. It is done by making a small incision in the skin, and an endoscope is then inserted and inside the kidney to remove the stone. And also we have stone basketing, where a cystoscope is inserted into the bladder and a stone basket is inserted to remove a kidney stone. We have renal biopsy, which is a small piece of a person's kidneys removed for analysis. A nephrectomy, this surgery is to remove kidneys that have cancers. A nephrophexy is a procedure that corrects the position of the kidney if it's an abnormal one. A transurethral resection of the bladder tumor, which is also known as TURP, is a procedure to remove a bladder tumor from inside the bladder. Urethroplasty, this is plastic surgery that repositions the urethral meatus. And that is all. I hope you all enjoyed my presentation and gained a little information from it. Thank you.